Anyway, we're going to focus on the content. We're almost at 1,000, guys. Okay, so today's topic addresses a subject that we actually go over in the home care Kickstarter program. Home care Kickstarter program. And I'm just going to do some housekeeping. Oh yeah, it's definitely still serves me and my viewers. Do you get a request from my page on TikTok? Okay, so I guess it's definitely good to share that two things. I only have one profile on TikTok, and that is Savvy Business Chick. There is someone pretending to be me, taking all of my videos, and has set up another TikTok page, and you'll know because it says Savvy Business Chick, and then it has like a underscore. That is not me, guys. Number one, I don't curse. People have told me, even my own cousin, say, "Oh, they reached out to me," and their response was, "Yeah, blah blah blah." SHIT. Number one, I don't curse. Learned that after watching, interestingly, the Malcolm X movie when Spike Lee did that, and I was young, and I became very fascinated how Malcolm X had an extensive vocabulary, and he felt like if you cursed, that's because you didn't have a good vocabulary. And as a young lady, I never really liked cursing anyway, even though I understand like some people like that's the way you emphasize things, right? Or in comedy, right? But I was never a big cursor. And so definitely I'm not going to curse in my broadcast. I'm not going to curse at you in a response, even when people have gotten upset and they are right disrespectful. I do not call people out their name. So that's not me. That's not my knee-jerk response. So, and then so that's first housekeeping on TikTok. It's only Savvy Business Chick, no underscore. And this is my page. So if someone has reached out to you and you're on TikTok and you notice it's Savvy Business Chick and it's my picture, but then look at that profile handle, and if you see that underscore, please report it because they have blocked me, so I can't report them, and I have to leave it up to you guys to report. Another thing, just things are moving, and I'm gonna even say that things are moving in the right direction. So I'm not a gamer, but I have a nephew who plays games, and back in the day, we had a Nintendo. I played the Wii games before. I've played games before, arcades and stuff like that. And one thing I know about playing games, guys, or arcade, if you're going in the right direction, I want you guys to pick this up. If you're going in the right direction, you're going to have some opposition coming at you, right? You ever seen those games and you have a weapon, or you're scoping out a situation. If you're going in the right direction, you have all these people coming out this way. But if you are going the wrong direction, you're like, oh, it's a ghost town, right? So be okay with if you are experiencing some challenges and things are coming your way. To me, that just means that God is moving. God is moving because someone hacked my Instagram account this past weekend. And I was just like starting to do like new vlogs with my behind the scenes, with like my mompreneur life. And I had shared a vlog. Me and my daughter, we had went to the Porsche dealership, and I said no cars were in this video, or this visit, which was true, right? Because I was actually picking up my car for service, right? I had to get my brakes fixed, right? So I was picking up a car, returning to load a car, and it was a good video. And then for some reason, boom, I got an email saying that someone had tried to log into my account, and it said it was from Mumbai, India. I'm like, oh, that's not me. If it was not you, click here to change your password. I clicked to change my password from and it was had the Instagram logo, Meta, and everything like that. Lo and behold, it sent me on this rabbit hole of I changed my password. It brought me back to my Instagram account, changed my password only for someone to message me to say, dun, 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 I have your account. And like, if you were to go look up Savvy Business Chick on Instagram, you can't even find me because they kind of like blanked it out or something like that. And instead of getting upset, instead of going, I didn't even like tell anybody. I didn't even like tell anybody. Like, the way I processed that is that, okay, God, this is not supposed to be happening to me, but I am going to just pivot, right? And I talked about the other day that there are pivots that you make. Like, so I have like multiple stories. I was in ROTC when I was in high school, and there's a pivot that you make that's fast, and there's a pivot that you make that's smooth, right? So I think I made a relatively smooth and fast pivot, and I started a new Instagram profile until I figure out what I'm supposed to be doing, because I'm absolutely not going to pay this person any money, even if I have it, because I'm like, you're not trustworthy, and I'm not giving you any my money for taking something that is mine. Now go figure. My Savvy Business Chick is trademarked, right? But it's trademarked. On my Instagram account, it is a check. I have a check mark, right? And so my mentees in my WhatsApp group were like, "What is Instagram doing about it?" Nothing. Instagram is the customer service for Meta or Instagram is the worst, right? So I'm gonna have to figure this out on my own. But in the meantime, I have started another Instagram account. Thank God I practice what I preach, right? I talk to you guys about having diversity in your marketing, and I also have diversity in my social media. My Facebook page is still up, so I have 17,000 followers on Facebook. My YouTube page is still up. I have nearly 13,000 subscribers on YouTube. My TikTok is up. I have nearly 13,000 followers there, right? And then I even have like 7,700 followers, right? This is different from connections on LinkedIn, right? So I practice what I preach as far as marketing is concerned. I apply the principles, and now I'm growing this page the same way that I would advise you to grow a new home care business page, right? And so I even said I was going to try to get on here and do maybe a 3-day series where we do like a challenge together for you if you want some tips and strategies for growing your social media page, right? And you guys can put in the comments I'm about to read right now, which page should we do, right? Because honestly, there is a different strategy. Thank you so much for the roses. I appreciate you, Jasmine. There's a different strategy for Pinterest. I actually have a Pinterest account too, for YouTube, for TikTok, right? It's a different strategy for each platform, right? And just with your the same with your marketing, right? It may be all marketing, right? Using flyers, using brochures, using social media, right? Just like with sports, it's a ball. That's the common denominator. It's a basketball. It's a baseball. It's a football, right? But different rules per platform, right? So that's what we have to do to be successful. So, but with that being said, today we're going to go over your HR personnel management, right? And we're going to go over your HR personnel management, and I am going to share with you a lot of the things we're going to talk about today are not mentioned in the Home Care Kickstarter program, guys. The Home Care Kickstarter program The spring semester starts April the 7th. The spring semester starts April 7th, and we go 9 weeks, 3 months. We go 3 months. We go 3 months. Let me get my weeks together, right? But definitely, I was looking at the agenda for the next couple of classes, and I definitely came up with the 9 weeks. If I need to do more, then I'll add some more. But with that being said, what we're going to cover today I don't want you guys to feel like, oh, if I join the home care Kickstarter, this is going to be a repeat of what I'm getting here. Absolutely not. You can even ask my mentees that join on this one. They're like, oh, Shauna, tell us that, right? Because this is fundamentals, this is 101, and then the home care Kickstarter is like your 102 or 202, right? So that's how we're doing it, and I'm going to highlight specifically in this section what we're not sharing, and it's not that I'm gatekeeping, but just to make a to show you the difference between this course and that program. So let me quickly answer your questions, and then we're going to get started. Good afternoon. Okay. I saw your question. Oh, they tried to get you. Yes, please block them. Oh, yeah, they're bad because I'm dropping gems. But the interesting thing, user 836, is that they're not even talking about home care. They're talking about Bitcoins, right? And so they're even talking about Bitcoins. Yes, my new Instagram page is Home Care Mentor on Instagram. Yep. And yep. Thank you so much, Kiki. My new one is Home Care Mentor. Thank you so much. And yep, because it's down right now, but it'll be up. Yep, I made a new page. But when that savvy business chick come back, it's gonna be beautiful. Hey, Tiffany from California. Okay. You would love to do Instagram or Facebook? Okay. Oh, thank you so much. Yep. All right. So today I just decided I'm gonna do a little bit of a lecture style today. I'm not gonna mix up the screens by trying to write on my flip chart, even though I got some new paper today, right? First, I want to go over like myth or truth, right? Oh, yeah, Bitcoin stuff is always a red flag. Okay, so how many of you guys heard that there is a nursing shortage, right? How many of you guys heard that there's a nursing shortage? And thank you so much for the hearts. How many of you guys heard that there is a nursing shortage? Oops. So when I got started, and I was telling my brother, I've been in business. I haven't worked for anybody else in 19 years. And I had to like kind of flex on him a little bit because he was trying to tell me some stuff. And I was like, I have to work for somebody else. It's my older brother. I ain't worked for nobody else in 19 years. I had to flex on him. You try to tell me how to do business. And I'm like, 19 years, buddy. Right? So I had to flex on my brother the other day. And then he backed off, right? Boom. So with that being said, when I got started, they were talking about the nursing shortage, right? So one of the reasons why I want to address the elephant in the room is because these are all of the things that people will confront you with when you say, I want to start a home care business. Oh, but did you know it's a nursing shortage? Oh, did you know it's a caregiver shortage? And I'm going to tell you, it is. It is. It is. It does exist. Guess what? It's been existing for a very, very, very long time. I can't remember the date. It's been like a nursing shortage since the 60s, right? So the fact that people use that as an excuse or a crutch to not start a home care or a home health care business, um, don't let that be that. Don't let that be your excuse, right? Um, there is not. It goes back to what we talked about as far as supply and demand. The demand is growing for, um, you know, you know, healthcare services, and we kind of haven't caught up to that. And just recently, more so COVID, there started to be a caregiver shortage, right? So you may even have heard that there's a caregiver shortage. And I would tell you that is true as well. But none of those things have stopped people from starting home care businesses. None of those things have stopped people from growing their home care business. None of those things have stopped people from making money in their home care business. And if you look at some of the franchises, I definitely advise you to look at some of the franchises because just yesterday, I think, or Monday, we were going over healthcare news. Like these places are expanding their territories at knowing that these factors exist, right? And one of the things I want you to learn is to know, my people are destroyed but for lack of knowledge. Know the information, but use it to your advantage, right? Do what's called a SWOT analysis. Have you guys ever heard of the term SWOT analysis? And if you can do me a favor, type SWOT in the comments. SWOT. 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 SWOT analysis stands for strengths, weaknesses, opportunities, and threats, right? And so when you are starting a home health care business, one of the things you can do is say, okay, maybe one of your strengths is that you are an existing healthcare professional. You are an existing healthcare professional, right? And so with you being an existing healthcare professional, whether you're on the caregiver side, CNA, home health aide, or you're a nurse, one of the things is that other healthcare professionals like yourself, and that could be an advantage for you recruiting, right? Sorry, right? And so that could be an advantage for you recruiting. Your weakness is that if you're not a healthcare professional, like I was not a nurse, then you may have a disadvantage for not knowing how to interview them. You may need someone else to interview them. You may need someone else to interview them. And just I often have people ask me this very important question, especially people who are not healthcare professionals. They'll say, Sean, should I go take a course? Should I go take a course so I can know what my CNA is supposed to be doing, what my home health aide is supposed to be doing? And my recommendation is no. My biggest advantage is that I started a nursing agency. Abigail, I'm not sure who you are, and I think you have the wrong person because I don't even recognize your name. That's the one trolling me on Instagram. So with that being said, so I have so I when I started my skilled agency, my home health care mentor was a registered nurse, and she actually said to me, "You should go to nursing school. You should go to nursing school." And that was the first time that I didn't follow her advice, right? That in the first part of my mentorship, there is I followed things that she shared with me to the T. But this was the first piece of advice that I did not follow. And I think me coming from, working with stockbrokers, being from my business background with my education, and just how I was just like learning things. I was learning things on the go. This was a new industry for me, that I decided to not take her advice, and I decided to do work on my business, not work in my business. Congratulations, you're a nurse for over 30 years. Yes. And I have a deep respect for nurses. And that was something that she definitely helped me to have as well. But my advantage is that because I started a home health agency, um, because I started a home health agency, when I ran into problems with recruitment, when I ran into problems with nursing, with staffing, when I ran into those problems, I couldn't go work. I could not go work. And that was the biggest advantage for me, that I couldn't go work. I think I'm getting another message from Abigail. We had just mentioned that there is a separate account on TikTok. Someone trying to pose as me. So like I said, I don't recognize you at all. So we're going to continue on with the message. So, okay, so here is some essential things of what makes a good caregiver, right? Here are some qualities of what makes a good caregiver, right? What makes a good caregiver is that we're looking for people, of course, who are compassionate, patient, and right? You don't necessarily, with a home health aide or CNA, one of the advantages if you have a non-skilled agency is that these things are trainable. These things can be trained, right? So there are a lot of states that are even developing and accepting a internal training program for people who work directly with seniors, versus if you have a skilled nursing agency or a nursing agency, you absolutely have to have completed like the RN program, passed your boards, and the LPN or LVN program, and pass your boards. Now, let me, I'm jumping a little bit all over the place, but I do want to state that a new RN can do an initial assessment, right? So if you're a care agency, non-skilled agency, a new RN can do your initial assessment. That is accepted. However, a new RN cannot go work on a case. So I would not advise you to hire a new RN, just pass their boards, to go work on a case if you have a skilled agency. Unlike a facility, that new RN has no one to bounce his or her ideas off of, right? And in the home setting, it's only one person there. It's only one person there, right? And so if that RN is looking for people to, oh, how do you do this? Or, I did this in my clinicals, but I'm not as familiar with doing it I still need practice, I still need training. It's not advisable that you use a RN that just came out of nursing school, just recently passed his or her boards to work on the case. However, a lot of states will accept that new RN to do an initial assessment. So if you have a friend or family member and they want to help you out by being your RN to do your initial assessment, you can use them in that capacity. You can use them in that capacity, but do not use them, whether you are skilled or unskilled, do not use them on that case to work directly with the client. I would not advise that, right? So going back to some essential qualifications of a caregiver, because I'm not using my board, I want to point out that we have multiple levels of a home, multiple levels of your field staff. So today we're going to talk about field staff. You guys write field staff in the comments, right? So this would have been a good level thing for my flip chart, right? So we have your homemaker and homemaker companion level. Your homemaker companion level is essentially someone that does not have to have a lot of training. Some agencies will require that that person, of course, needs to complete the application process. The person needs to complete a background check. The person should complete the basic required training for the state, which we're going to go over some of those topics. And the person, a lot of states for the homemaker companion level will are requiring that they have a food safety certification. Now, I want you guys to type in food safety certification. Food safety certification essentially is a easy class that that person can take, and that will ensure that they are, when they are doing one of their main functions as a homemaker companion, which is cooking or meal preparation or assisting with feeding or nutrition, is that they know how to keep food safe, right? Then safe so that it's not expiring, right? They're not leaving things on the table or on the counter for long periods of time. We had a client one time who was a chef, right? And for whatever reason, this nurse changed the client's son and put his diaper on the counter. This guy freaked out. I mean, this was the only time I've ever heard from the dad. I always spoke to the mom. The family was really, and he was just like appalled that she would even do that. And he let me know, because he is a chef. Like you don't mix, that diaper. It was completely she said, as he should, right? But you know what? It was like it was a listening moment for that client, and so I just, it was good. But they would have learned that in the food safety certification class, right? So with that being said, that is level one, right? Level one. And in a lot of states, the homemaker companion does not touch the client. The homemaker companion does not touch the client. Now, you may think, well, why would I even hire someone like that? Why would I hire someone who, can't touch the client, right? There are actually a lot of cases where someone is just there to monitor the person. They can still move around, get around by themselves. They can even still cook their own food. So the companion is essentially so they won't be by themselves. So they're not alone, right? So is it a liability? No, it's more so some of the everyone knows that the homemaker companion has the least amount of training. And so, most states weigh on that the homemaker companion level should not touch the client. And then I'm not sure if we're going to be able to get into, like we cover doing a client assessment in our home care Kickstarter program. And so because we go over that in the home care Kickstarter program, we go over how you're essentially supposed to assess the client and then match them to the appropriate worker. Have you guys ever heard of matching matching your client with a caregiver? That's essentially how you would do that. Okay, so then your next level, it is either I'm going to give you 3 titles. It could be a home health aide, and it's going to vary depending on where you're located. Home health aide, personal care aide, home health aide, personal care aide, direct support worker. That is level 2, right? Level 2. Now, a home health aide in some places has some experience, but maybe they've worked privately with a lot of clients, but they never completed their CNA certificate, right? So the home health aide knows how to give a bath. The personal care aide knows how to give a bath. They can do some personal hygiene, right? Mostly, we would level that person up to bathing, but we would stay away from some of the things that the CNA is trained on. And I'm about to touch on that in just a second. And so for that instance, the home health aide, personal care aide, or direct support worker, whatever it's called in your state, we would ask for that person to have not only the criminal background check. We're going to say the first food safety certification. Next up is going to be at minimum first aid certification. First aid certification is now what we're adding on. Food safety, first aid, right? So they can touch the client, they can do some personal care, but now we're on level 3. So level 3 is your certified nursing assistant. Certified nursing assistant, right? Your CNA. Your CNA has gone through a formal they use all those titles where you live. Where are you at again? Yeah, and that's why I'm interchanging because this is kind of like your vocabulary, homemaker companion. I'm trying to break it down. Homemaker companion should be a part of your Iowa. Homemaker companion should be a part of your HR vocabulary. Personal care aide should be a part of your HR vocabulary. Home health aide should be a part of your HR vocabulary. Support worker should be a part of your HR category. And these are actually job titles, right? So depending on where you live, like She Means Business is saying, this could be a job description that you're giving out, right? And let's say, for example, you have someone that starts out as a home health aide, and then as she works on he or she working with your agency, she goes through the CNA program, gets a certificate, then you would have 2 job descriptions in his or her personnel file, right? One showing that when they were initially hired, they were hired as a home health aide. And then at the date, whatever they got their certification, they transition to a CNA. And then you would show both in the personnel file. You would show both in the personnel file, because then the state, if you ever got that person's chart audited, they would want to know, why this wasn't signed. Like if you remove the home health aide job description, they will want to know why it wasn't signed on the hiring date, right? Because they're going to look at the application, they're going to look at the references, they're going to look at that, they're going to audit that file, and they're going to want to know why there's a difference. And a lot of times people don't tell the story of what's going on in the file. According to the Texas regulations, to provide home health, it must be an aide and it must be registered. Right. Each state is different. So for your state, home health aide at minimum, and then CNA next up. So the CNA has gone through a formal training and has gotten a certificate, right? In some states, the CNA certificate can even be looked up on the Board of Nursing, right? You can look their information up on the Board of Nursing, right? Because not similar to a nurse, but respectfully, they have to keep their certification active, go through, in some states, they have to take in services to keep, to refresh their knowledge, right? So one of the main differences with the CNA and level 1 and level 2 is, okay, so the CNA at the CNA level, he or she can take vital signs. They can do check the heart rate, blood pressure. They can do some more medical things. Some CNAs are in their training program, they can do catheter care, right? So let's say, for example, someone comes comes from a facility and they're bathing them and they have a catheter. A home health aide should not touch that, but in catheter care, they can do catheter care. They can do under the direction of a registered nurse, they can apply certain medicated lotions, right? They can apply some medicated lotions or shampoo, right? And it would, if they are directed, or a better term is delegated by a registered nurse to do so, then he or she is allowed to shampoo the client. So with the CNA, they take the care up a notch, right? They can do foot care, right? So technically, they wouldn't want a home health aide to do foot care, because if the person is diabetic, then they wouldn't want them snipping, and then that causes extensive bleeding with someone that's diabetic. Home health aide or a CNA can do oral care, hair care, as long as it's not with medicated shampoos. I mentioned the catheter care with for the CNAs only. They can do body mechanics, basically helping them get in and out of bed. Both can do mobility, helping them get it out of bed using a Warrior lift. Both can do that. Let me see, what was another difference? DNA. I think I definitely need to do a parallel. Like I said, the vital signs. Okay, so this at the CNA level, here's another last example. At the CNA level, you're more likely to choose the CNA if you have a non-skilled or even a skilled agency to perform medication reminders, right? Because medication reminders is essentially not medication administration. Medication administration is essentially a nurse, LPN, LVN, RN, following doctor's orders to administer a medication to a client. Let me see, I have some. I actually got this because I was gonna do a reel, right? So this is a pill box, right? This is a pill box, right? And so I'm still going to do the reel, but this is a pill box. So a CNA, this is medication management, this is what it looks like, right? CNA cannot fill in the medication. No. She cannot add the blood pressure medicine in the morning, the water pill in the afternoon, and the multivitamin at night. Even though it's a multivitamin, she cannot add it. No. What she can do is read this. She will have her own medication profile or information that's on the individualized plan of care saying, hey, I need to remind Ms. Smith to take her water pill at noon after lunch, right? So your RN essentially would go and fill this up. Family members can also fill this up. 2 people can fill this up. Family members, RNs, right? Right? So it's that time of the day for that water pill. Miss, your nurse, your CNA can say, hey, Miss Smith, I want you to get ready to take your medication. She can open this up. This one has a divider. She can open this up. Need some nails. All right, now trying to let me break. Okay, so imagine this is open. She can open this up. I got rid of my nails because I washed my hands too much. She can open this up, bring Miss Smith some juice, open up the juice, and put it right beside her. But she can't crush it. She can't take it out. She can't say, oh, you're supposed to take 2. She can only remind, this is the time to take it. Now, on your side for your documentation, she can observe her taking it, swallowing it, and saying it was 2 in here and now it's none. That's the documentation. That's the documentation part, right? And you want that, right? That's a part of that. Then that part becomes medication management. So the reminder is the act, is the act, is the act. The management is to document that, I was with her for 7 days. She took all of her medication. She took it on time. I observed her, and there was no problems after that. Your CNA cannot crush a pill, cannot put it in applesauce. She can bring her the applesauce cup. She can bring her the yogurt cup, but she can't put it in there because all those things are dancing around administration, right? So It's called self-administering. Now I'm covering a topic that's outside of this HR section, but this is so important. I actually wanted to talk about this anyway. It's called self-administering. This is an example of them self-administering the medication. So they can bring them juice, they can bring them water, they can open it up. They can even bring this juice to their mouth. They can bring it to their mouth. They can bring a juice or water to their mouth. As long as that client is the one holding the pill and did like that, they can help them by bringing it to their mouth. But they cannot administer that medication to them. Everybody got it? Yes, they can. Yes, they can. They can. The question is, can home health aides use mechanical equipment for transfers? Yes, they can use. They can use a Hoyer lift. They can definitely use that, because remember, at level 2, the home health aide, the personal care aide, the direct support worker, they can touch the client. They can, right? They just need to stay away from a little bit more advanced things, right? All right. All right. I'm making sure. All right. Making sure I didn't miss anything. Okay. So, and these kind of things are, so we're looking for, I started talking about qualifications. We're looking for compassionate people. We're looking for patient people during the interview process, right? You're going to be looking for people with experience, guys. But guess what? I have, that goes back to me talking about training. I have hired people in my office and people who are at the CNA level. At the CNA level, we can go to the CNA schools. Did you guys know that there are CNA schools? You can go to the CNA schools if they're going to be working with the client. They're going to be working directly with it. But it's definitely not advisable for your LPN and RN levels. Actually, let me go to that. Level 1, homemaker companion. Level 2, home health aide, personal care aide, direct support worker, whatever they call it in your state. Level 3 is CNA. Now, I want to briefly mention a new title that's in some states, and it's called a Certified Med Tech, CMT. I don't particularly like certified med techs. To me, they're like the in between the CNA and the LPN. And to me, in a home care setting, they're a little bit too much to deal with, right? Because the rule, and you should look this up on your board of nursing, is that a CMT is a little bit above a CNA, and he or she can give medication, right? So that means if your client has this medication that we're talking about, you have that certificate, or they need to get an insulin shot, they can get it. But from an operational standpoint, I have, and just starting with skill, I've just preferred the LPN over the CMT. And no offense if you have that certification, only because operationally it's very, very messy to me, because if the RN has to observe the CMT for each function that they are going to perform, right? And they actually have to observe it per client. So that's a difference in the home care setting. They have to observe it per client. If you're in a facility, then remember, in the home care setting, it's a lonely place, right? You're the only expert there. You're the only healthcare professional in a facility. Then the RN is right around the corner, right? So she has to do it per client. So that's one of the reasons why I didn't like that model, is because let's say I put a CMT on that case, and then, she's a good, or he's a good CMT, and then one day they can't make it because they got a flat tire. Then now I have a situation where I have to staff another CMT, then get the RN to come out and verify that they can provide certain, they can perform certain duties. And that's an operational headache, right? I prefer the LPN level, and I'm a little bit biased because I started as a skill, because with the LPN level, the LPN can act she or he can act independently following the doctor's orders. She don't need the RN unless it's things that fall out of his or her scope, right? And just like we have scope of services for home care, for the registered nurse, or the licensed practical or licensed vocational work, that's scope of practice, right? And it says that in your state's Nurse Practice Act, it will say what things they can do and what things they cannot do. What things they can do and what things they cannot do, right? And so, say for example, one of my, I think maybe my third client, private pay, again, this client had something called a TPN diet, right? Where the way, you may be familiar with G-tube feeding, where it's like a tube that goes directly into your stomach, for layman's terms. But this one went directly via IV, right? And so, according to the Nurse Practice Act, my LPN, who was a cheaper, who was a less expensive workforce for me, could not perform that function. Even if she was an IV nurse, even if she had a certified IV nurse, she could not perform that function. So I had to really manipulate, that getting an RN to work on part of that case, right? Part of that case, so that could be, but for the most part, she can give out medications. She could do all of the nursing treatments. She did so much that it was less expensive to have the LPN provide the service than it would have been for a CMT. And they weren't even like around like that when I first got started. So that's why I have a little bit of bias towards LPNs. Operationally, it's a big headache to have to, if you have a staffing issue. Okay, so then after that is the RN. The RN, guys, is always the lead, is the head of the pack, right? And so what I also just gave you is a good outline of how your organizational chart should even look, right? Your organizational chart should always have the RN. Sorry, I gotta verify. Should have the RN, or in some cases, it's the RN supervisor. It's the RN supervisor, RN, LPN or LVN, home health aide or direct support worker, homemaker companion. That is how the organization chart. The RN is always at the lead for two reasons. Number one, the Nurse Practice Act for your state says the RN is the lead. even if that RN has less experience than the LPN or the LVN, he or she always has the lead, right? The RN can obtain doctor's orders. An LPN, LVN cannot, and definitely not your lower level healthcare staff. And the RN is who we need in both situations, skilled or unskilled, to do our initial assessments and our supervisory visits. So we're always going to need a registered nurse in our business somewhere. If you are non-skilled, some people will hire an RN as a contractor, right? Just to do that function. And I would say for the most part, that could be allowed, even though we are leaning towards a W-2 model, just because the RN can function independently because he or she has their own license, right? And if they're only doing that function, especially if you're starting out, you can use that person as a independent contractor. Do we need an RN for the license application? What are the qualifications for a home care admin or administrator? What state, Jasmine? So do the caregivers report to the RN? On paper, that's a good question. On paper, the caregivers are supposed to report to the RN, but operationally, the caregivers actually, the first people they report to is your scheduler. Your scheduler has the most contact. You'll see this when you get your business started. Has the most contact with both your clients and your workers. He or she are your main liaison between the both two. Having a good scheduler makes a very successful business, right? Okay, so that's it, right? So we want to look for people that's compassionate, patient. When you're going through the hiring process, you will evaluate that. But let me give you a piece of advice. Try not to, if you are in a corporate setting, I'm gonna need you guys to take a chill pill on evaluating healthcare professionals by the same standards of how we evaluate, people going to the corporate setting. Kind of like the term learn your audience is really, really essential, right? That's what helped me to have a good recruitment strategy where my home care agency, we were at 135 active workers and about 93 on roster. That means 93 I can pull from at any time. And out of that 93, I can say, okay, this one works, is available on weekends. This one is available at night. This one is available in this part of town, right? So your roster has to be functional, right? Has to be functional. And so one of the, I think coming from my background, like my HR department had a sales quota, even though they were not selling services, they're selling, joining, you should join our company. You should become a part of our team. And so we had to onboard at minimum 10 people a month, right? So 10 people a month. So that means that with a robust recruiting process, it's almost like, having a party, right? You want to invite more people than you expect to show up. How do you roster caregivers if you don't have any clients? So we go over that in the home care Kickstarter program. In short, you would not be doing a roster. You would not be rostering. That would not be your function if you're just starting out. You would not be able to roster. And that's something, and I appreciate you asking that question, Sabrina, because a lot of people try to roster when they don't have any clients, and because they want to have this large pool of people to pull from, to be able to say to their potential clients, oh, well, we have 10 people. Well, you can't do that. You can't roster when you're first starting out. The majority of the roster, are they 1099s or W-2s? They could be both, right? And wrap around that your W-2s don't get paid until they work. Your W-2s don't get paid until work. I was at Staples earlier today for something I'm just going to put together for one of my mentees. Usually if someone is in my one-on-one home care licensing program, after they get licensed, I send them a gift, right? And so I'm still going to send her this one gift, but I decided to change up the second gift that I give to be some essential supplies, right? And I was going to actually set two things up for her. And but I bring that up to say that at Staples, if I was to go work at Staples, right, I don't work until they put me on the schedule, number one. I don't work until they put me on the schedule. And then so I'm hired, I completed the application, I've gone through the application process, right? And I may even come in for training, but then after training, so that's a little bit of difference between like this. After training, I don't get paid until, excuse me, put on the schedule. So that's your leverage, is that you can have a W-2 staff, but they don't get paid until they're actually working with your staff, with your clients. Yeah. Yeah. Right. And that's in your state. That is in your state. Because that's not all states where they will request that. So do you wait until you have a client before you hire? I don't recommend that you wait until you have a client so you hire. I'm just saying you need to do more marketing than you're doing recruiting. So that's my first answer. You need to be doing more marketing than you're doing recruiting. And so essentially, if your left foot was marketing and your right foot is recruiting, and then you're going back out again. So you're doing double the marketing, and then you're doing that step of recruiting, right? Again, we go over that. We go over the marketing, your recruiting plan, your interviewing, your hiring, your screening. We go over all of that in the home care Kickstarter program. So good questions. But if you're trying to wrap your mind around it, just know two things. Like this is a great error that a lot of people do, and I believe they just don't believe that if they don't have that worker who's ready, like somebody about to jump into a double dutch rope to work, that when they get to the client, when they get to marketing, because like, as you can see, marketing is not even on their first priority, which it should be, that they want to be able to say, we have somebody to work. But most of the time, people that do it that way, which I feel like is the opposite way, is that 9 out of 10 times the person is not even available. The person is not even available. And then they're upset because the person's not even available to work. My own personal experience, my very first client, the one that I said 24 hours private pay, I got from a facility, right? I got from a facility. So with that particular client, I had no one in mind. And number two, I didn't even know that the client was going to be 24 hours, right? So you have a couple of disadvantages by getting the caregivers first or your workers first at your initial stage of business, because you don't know what to expect, right? You can hire a whole bunch of people that's not even available in the area for the shifts that your client has. So that's one of your greatest disadvantages. So the first time I went, I was learning about the client. They told me that he was going to get discharged on a certain day. So then that's when I started working on it, because I knew about the client now. I knew about his needs. I knew that I needed to get a nurse that had experience with a ventilator, right? And so then when I learned from my mentor at the time that, those kind of nurses are hard to come by, then with talking to the case manager that gave me the referral, she said, well, if you have the nurse come here, then we can do her training. Now that was like, God was just lining everything up. So I got free training for my nurse. So I just started, I recruited one lady who was an old school pediatric nurse. And as soon as she came to the hospital or the facility, she saw the client, she got the training, it built up confidence with her. She said, I know 2 other people that I can get to work another shift. She was trying to negotiate with me that she wanted certain days, right? So because she was the first person to respond, I was willing to give it to her, right? She ended up working herself out of that case, right? Just because she was just so super particular, right? But she got me in the door, right? So that 24-hour case, I only had 1 week staffed. And I said, I'll take it. I can take it. I didn't have the whole month staff. I was working on next week. I had the whole week staff. I didn't think about what is the client going to think when I bring somebody else in here next week that's different. No, I was problem solving. This is how I move. I problem solve on the go. You know how they say, start walking and the bridge pathway is going to build, right? And so it takes a certain kind of mindset to do things that way, because you are going to feel like, especially if you come from a corporate background or professional background, no, everything has to be absolutely together before I can say yes to this client. And I'm telling you that it doesn't always have to be together. And this is why some of you guys don't even move to start your home care business, because you're looking for all the ducks to be in a row. Okay, I got $25,000 saved up for in grants or in loans. You're looking for all your ducks to be in a row. And some of the most successful people that I know, they don't function like that. They didn't function like that initially, and they don't function like that going forward as they scale their business. So did some marketing, learned about the case, met with my referral source. She gave me more of the details of who I should be looking for. So it was a detailed job post, who I should be looking for. She gave me a timeline. Client's going to be discharged on this date. By the grace of God, the date got extended. At the time that he was going to get discharged, I think I only had 4 days. It gave me more time to recruit. Just using, just some being innovative. The nurse helped me out. I did some recruiting. I put some stuff on, did some ads. I had to fast interview all of these people, get them to clear, the qualifications to clear before I know that they will be working directly with the client, and then encourage them to go get the training. Now, I have some negotiation skills, which I strongly encourage you guys to develop. And so I was able to negotiate or persuade 3 of my nurses that I was not going to pay them to get training. So they wanted to be paid to go to the facility to get training. And I was like, well, this is an investment in your job. I am, I'm going to give you, this much an hour, which was a premium price back then for working, working as an LPN. And, you're going to have a very stable case. It's going to be your case. So I not only did some good negotiation, but I really, back then, I didn't even know what I was doing. I really dug into the culture. Like, this is going to be a good case. It's going to be your case. You're going to make sure this client doesn't even come back to this hospital, right? And so I was able to staff that case. And by the end of the month, of course, I had the whole month completed. I had the whole month filled, staffed. And that was his nurses. Client never asked me, well, do you have the rest of the days available? They didn't ask me the questions that you might think clients are going to ask you, right? Because once you build that trust, right, and you're working and they see, like the client didn't even complain when I was sending her people to Orient once he got home, right, to Orient. She just saw me moving, right? And to my benefit, it was she was used to a facility environment, because in a facility they get new nurses every day, right? Signing the board, right? So she didn't know that, I ain't supposed to have all these people coming up in my house. I should have like some regular people, and she eventually did. And I used, the client satisfaction system that we talk about. But I used it at the early on. Give me feedback. What do you like? What do you not like? Right? What did you like about this person we sent? And I used that to hire more staff. Right? Now, a lot of these things my mentor did not teach me. She did not tell me. It literally came intuitively, and I definitely tell you guys, I prayed a lot in my first year of business. So I felt like I was just getting like downloads from God of how to do things, and it worked out. But I can tell you, like, I have a friend whose name is Carl, or people say the Ballhead got on YouTube. His company makes revenue is a little bit over $1 million a month. Other people who are successful in home care business. And if I want you guys to get unstuck with, get out of the mindset of it being perfect before you say yes to the opportunity, before you start. It's some kind of fear you may have. And I'm not saying, don't use discretion, if don't use discretion, but you don't wait till you have everything all together before you make a move. That's not what CEOs do. Okay, sorry, went on a little rant there. So let me close up. Ask you questions. Sabrina, CNAs can do vital signs and things within their scope in non-medical California. Yes. How do we register for fingerprints for application? I have no idea where you're located. Can non-medical agencies get contracted with nursing homes and hire CNAs to go out? Lux Bay B, that's a healthcare staffing function. So non-medical agencies, some states have a separate license for healthcare staffing or for staffing. And they'll either call it a staffing agency license, nurse pool, or registry. And so if your state has any of those terms, then you need to apply for that additional add-on to your license or separate license in order to contract with nursing homes to hire CNAs to go out, right? That is a staffing function. Can a physician's assistant replace an RN as administrator role or lead? No. Say you know nothing about the codes, who will hire a coding specialist? I'm not understanding your question. In Maryland, you do not need the RN. You currently do not need the RN on your license application. If you go to the site and you actually look at the most recent RSA application, there's no space for the RN anymore. There was a place where we had to put in the RN's license number and send his or her resume. Currently, that's not requested. And as proof, one of my most recent mentees that just got licensed, one was in Maryland. We didn't submit any RN information with her license. So just reiterating, can a PA, which means a physician's assistant, replace an RN in a home health care agency setting? The RN is still the lead. RN is still the lead. And they honestly could care less if the RN is a nurse practitioner or not. They just want a registered nurse in that role. And when you get to the home health agency level, then administrator is either a doctor, physician, or RN. So they have not accepted like a PA in that position. Starting one in Arkansas, what are your thoughts on operating 3 hours away, planning on moving? It can be done. I have people that operate, live in New York and own an agency in Ohio and Pennsylvania. So you can do multi-state. If you're just starting out and you don't have a scheduler or human resources, who do they report to? You're the one doing the work. Okay, answer some of those questions. So do you wait until you have a client before you hire staff? You can build your team, but it's more advantageous to you to start doing your marketing first. I wouldn't be I would, Ralph, you can't, different states have different rules. So Chill Sexy Cool is in, Texas. In Ohio, I have 2 mentees in Ohio. They do not have to have any kind of roster to work with MCOs. So different states, different rules, as you guys are sharing information. Different states, different rules, right? And it's very easy. It's easier in Ohio to go on board with the Medicaid and then the MCOs than it is in her state, especially also because she's doing the home health agency. Running into that problem. Okay. Meanwhile, you advise to do the opposite by a consultant. Do the opposite of what? Your friend is a traveling nurse and does pretty well for herself. Yeah, traveling nurses are good to build relationships with if you want to contract with someone to just do your initial assessments or your RN supervisory visits, right? Because if they're a traveling nurse and they're in your state, that means that they have a compact license and they can work in your state. Thank you for sharing the live. Stepping out on faith. Absolutely. I am going to give you guys the information and you use discretion. I can only tell you from my experience that and one of your greatest qualities that you will develop, I'm going to speak that into existence, is problem solving, right? I have a mentee in Florida. They called me frantically last week because of a client that they had, backup caregiver didn't show up to relieve their staff. And so we handled it over the phone. Fast forward, when we that you were really, really good at scheduling because of how you handled that situation over the phone. I and all of the options I gave her, she was trying to, should I go? I can just go work the case. And I adamantly told her, do not go work the case. Do not go work the case. And we problem solved 3 different strategies for her not to go work the case. And that is what worked out. And it wasn't that I didn't want her to get used to that knee-jerk response of working the case. I wanted her to get used to problem solving an issue with her agency. And so then when we went back to review, we saw the issue was with when she admitted the client, she didn't complete certain steps that would have caused the scheduling issue to not happen. Yep. In this industry, it does require a lot of stepping out on faith, right? And this is why I try to give you guys the information first, right? The information will make you feel more confident. When I say do your market research, I'm not just saying that for nothing. I'm just saying it will help you with making wise decisions. If you know that, like we briefly touched on, there's a caregiver shortage, right? But you need to see what that looks like in your state, right? So maybe there's a caregiver shortage, right? But it's booming in your state, right? But if it's booming in your state, but people are expecting more pay, right? It's not that it's shortage, but it's that they require more money. Then you need to know that and then go back to adjusting your job post for what you're offering, adjusting your profit margin for what you're going to for with your expenses and what you're going to have left over. So you need to look at it from that angle. Yeah, you don't have to get everything ready first. Oh, thank you so much. How long was what training? If you're talking, because I'm just going back to the questions, if you're talking about the training that they got at the hospital, it was, I'll keep calling hospital, because it had two different functions. It had like a hospital / rehab side, right? So because of how I communicated with the case manager, with the referral source, I asked that the training not be more than an hour. So then when I was pitching it to my staff, I was like, it's just going to take you an hour, right? So if they went over, which 2 of them did, that's on you. Because at that point, I had no money to negotiate, right? I had no money to negotiate. So from there, you got to customize staff for clients. Yeah. Yes, because I heard someone else say hire first before you get the client to send them out. Yeah, and please forgive me. I'm going to get to your questions on YouTube. I'm not ignoring you. I posted on YouTube, and I got a troll, and I addressed her twice, and it's like that thing where I said someone took my name and with this whole Bitcoin thing, but I don't like not addressing things because then people think you're shady if you don't address something. So I addressed it in between our session. But anyway, if you go on all of your home care Facebook sites, Facebook groups, people are going to tell you hire first before you get the client. But if you process what that looks like, if you hire first, then your caregivers, your workers are going to be waiting, right? If you market first, then your fear is that your client is going to be waiting, right? But let's go through that. Your marketing, when you get that initial call and you know from the phone a call that they're really, really interested, or what we call a warm lead, then you can start an aggressive recruiting process right then. You can start an aggressive recruiting process right then. If you have a recruiting plan, you can send out a post before you go to that client's home. Right? You can start an aggressive recruiting process right then. Get some people interested. You will be able to be more targeted, right? Because you know the area, you know what the client needs. If they're looking for a night shift, if they're looking for a day shift, right? And these are all the questions people are going to ask you anyway. So your fear of not being able to be ready, more than likely, it's going to take you anywhere from 3 to 7 days to onboard that client. Here's why. The client, you got to go do the initial assessment. You got to get them to sign the paperwork. If the client's coming out of the hospital or rehab, right, you got to wait for them to be discharged. And lastly, the startup date always has to be discussed, right? It always has to be discussed, right? You have to find that out from your potential client. When are you looking to start? When do you need the help? Some people go shopping before they buy. You know, look at us. We go shopping for a car before we buy. We go shopping for a house before we buy, right? So that could mean that they got a big surgery coming up and they know they're going to need help. I'm going to call you 2 months in advance. So you have to like process, that theory. And I'm just saying from my experience, it has not worked out. And our current promotion, I'll go over that in just a second. Let me answer the last couple of questions because we've gone over. You mentioned scheduler. What are the other positions as far as office staff? Niche. Let me address that in just a second, please. Okay. A lot of people if you were advised to hire and onboard staff before seeking clients, give me a number one. Chill Sexy Cool said this happened to me last week. The main caregiver didn't show up and called in late. I used to work my case. It was hard. Yes. I'm experiencing that now and it's hard. It doesn't take long to onboard an employee. Correct. Why it's so hard to get networking? Okay, really quick. Found you on YouTube a few days ago. I just had it, and you have just about given me the answer to every question I had. I plan on purchasing the California package to get licensed. Come on. Where can I sign up for your mentorship program? Are you accepting any new mentees? Tiffany, are you an existing business owner or are you looking to start a home care business? Hey, Tiffany from California. Okay. If opening a skilled home, how much experience would you say an RN should have to work on a case? Okay, so good question. And then we'll wrap up. If you're opening a skilled home care agency, nursing agency, this is going to be kind of tough, but no less than 6 months, preferably 1 year. If you want that RN to work on the case, no less than 6 months, preferably a year of experience, right? We even had one of my mentees that's in our WhatsApp group, right? So my WhatsApp group is for people who are in my one-on-one licensing program or were in my one-on-one licensing program, and people who are current or past home care Kickstarter mentees. That's the only people that's in that WhatsApp group. So sorry, you can't join because that's continuous mentorship. Even before this class, I was in there giving them some business about some things they needed to do, right? And so with that being said, one of my mentees, one of my former nurses, right? I'm not going to say her name, right? My former nurses, guys, she started as an LPN, working for my company. She went to school, became an RN. And as soon as she got an RN, she was like, okay, so now can I do RN supervisory visits? Because she knows that we pay extra for that, right? Guess what? She didn't have the experience. She had the experience being an LPN, and she was a really good LPN. Worked with multiple cases. She could work with high technology cases. Somebody had a ventilator. Somebody had a G tube. Somebody had a GJ tube and G tube. Trach change. She could do all of these different things. But as soon as she became an RN to stay in compliance, the state did not see her as having all that experience as an RN. So she had to go get experience. Devastated, she went to go get that experience. She went to a nursing home and she said, I'm so glad that you encouraged me to get this experience because it was now different with me being the lead, right? So once she hit her 6 months of experience, an opportunity opened up, and we actually hired her in the office, right? She became what we call a quality assurance nurse, right? So she became a quality assurance nurse. I'm tempted to post a picture I just found on my phone of her doing training with some of our new staff, right? Doing we had these training dolls, right? To verify that people had the skill. But so with that being said, to answer your question, whether you are a nurse or not a nurse, if you're doing a nursing agency, and you're hiring a nurse, LPN or RN, they should have at least 6 months experience. Okay, so in closing, no problem. Okay, so in closing, my one of my coaches, I have a mentor now. The mentor to help me start my home care business. She passed away, and several years ago. So in the meantime, I acquired another mentor. But from time to time, I take classes myself, right? Because I am just like you guys. I'm a big component of. I'm a big advocate, of really knowing information, and a lot of the social media information changes. So she's like, Sean, you need to do a sale. And I only do sales, guys, for Black Friday and Christmas. She said, Sean, you need to do a sale. Right now, people are struggling because, prices have gone up. And I honestly, it resonated with me because, like I said, I have a lot of family members and associates, because I'm here in the DMV that work for federal government. And my sister sent some people to me, and just people I think if I leave here, I'm going to start, business and healthcare. The way I've heard you, the way you put it, it sounds good to me, right? So with that being said, we have a sale until next week, right? So with things supposedly going up by 25%, right? They said that the tariffs may potentially take things up by 25%. I have decided to put a 25% off sale on my upcoming home care Kickstarter program. So that is what Jasmine was asking, and that's what I think Tiffany was asking. So that is the sale, right? So if you want information on that, the link is going to be in my, if you're enrolled in the HillmanTok course, you will get that link via email. If you're enrolled in the HillmanTok course, you will get that link via email. If you are not enrolled and you're just catching me, then you want to go to my link tree and click the link for that sale. I'll try to highlight it so that you can get access to it, right? And there's so many things we didn't go over today. We're supposed to go over the importance of the background checks and references, the type of training that your home health aides require for per state, retaining your workers. And I'll post the key terms for this week. All right. So, and I'll post the homework via email. Now, with 2 classes left, I want to squeeze in an intro to your home care marketing, right? I would love to squeeze that in. So I'm going to have you guys vote on what you would want. So we can either do that. We can finish up this personnel section. There is a client section that we need to cover. Or we can do the intro to marketing. In the Home Care Kickstarter program, you get 8 trainings on how to market your home care business. And then you get on traditional marketing, and then you get 3 on social media marketing. So essentially you get about 10 to 11 trainings, right? And then lastly, what we covered here versus what we cover in the Home Care Kickstarter program. In the Home Care Kickstarter program, we cover how to build your team, how to roster, the hiring process. We go through the entire hiring process. We go through the documents that you need for for your W-2s or your 1099s, how to do your skill assessments, best places for you to get caregivers or nurses. We give you like a job posting script how to keep your personnel files in compliance, because that is an area where you can get audited, and building a company culture, which is like your retention strategies. Retention, basically how to keep your best caregivers with your company. Yeah, how to keep your best. So, and that is a major operational system. That is a major operational system in your business. And I was asked, what is another key role for your business? Of course, you have to have a registered nurse for your initial assessments and your supervisory visits, whether you're skilled or unskilled. Your scheduler puts everything together. Your scheduler meshes everything together. Some people, they hire out or they outsource like a recruiter. When you get to a certain level, you will need a recruiter to be constantly working on onboarding personnel. We talked about like having like an HR person that processes the paperwork. Some of my mentees that are already established, they outsource that too. So it depends on if you have your records, your files in the office or on the software. We've talked about different roles in different sections. We talked about having like a bookkeeper and stuff like that to do like your payroll or your billing. So I didn't want to disregard your question, but scheduler is a really big role. It's a really, really, really big function of a home care agency. And a lot of people won't tell you that because I don't know if they're gatekeeping or they just don't know. But one of the things that made me at my highest, we were over 5 million a year in revenue. We had 3 schedulers. We probably could have had 4. We had 3 schedulers. One was a senior scheduler, and the other 2 were, junior schedulers, right? One of my schedulers went on to be a doctor, guys, right? Pretty proud of that, right? So he was in medical school, right? He was in medical school because he needed a job, and he worked for us until he got to the point where he had to, workload was getting too hard, and so that's why I said some of the untraditional qualifications that you would think certain job roles have, job positions would need. You just kind of need to think outside of the box. My lead scheduler worked at a call center, and she was so good over the phone handling problems. So I'm just giving you my experience to say sometimes go with the untraditional and and then train them and then get the best results you need. Oh yeah. Yep. So with that being said, thank you so much. Sorry we went 2 hours today. I wasn't expecting to go this long. Did I answer all your questions on YouTube? Can a LPN open a home health care facility in Kentucky or just a PSA? You can open a home health care facility. You will just need an RN on your application. Is there a code? No, because on that platform, I just took we just put the timer on and we just reduced the price. I'm gonna let me try to put the link up. Give me 5 minutes and the link will be live. Go to my link tree or go to my home care mentor Instagram page, link tree, it'll be there. And if you're on if you're enrolled in the class, we'll send you the link right away. Okay, bye guys. I'm sorry. I don't want to keep you any longer. Have a good day. Okay, bye guys. Sorry. I will make sure that link is available in 5 minutes. Bye.